Hello and welcome to Spotlight on East Fishkill. I'm Councilman Nick D'Alessandro and I'll be your host today. Spotlight is a show brought to you by the town of East Fishkill where we highlight local businesses and other public venues. Today we're here at Orthopedic Associates on Route 52 in Hopewell Junction. Let's go in and take a look. Well, here we are inside Orthopedic Associates, and we're here with Dr. Bill Coleman. Doctor, how are you today?
I'm great, Nick. How are you?
Excellent. So, Doctor, tell me, how did you get started in this business?
Well, I always liked sports, and I liked taking care of people, so orthopedics was a natural for me. I felt like it was a good combination of taking care of athletes and helping people out, so orthopedics was a natural choice for me.
So when did you get started in that type of business, and when did you, what did you really focus on when you went to medical school?
When I went to medical school, I went really for one reason, that's to go into orthopedics. I really always loved the field, and some people when they go to med school, they don't really know what they wanted to do, and I really went for one reason, that was to go into orthopedics. So.
That's wonderful. And, you guys have one of the foremost orthopedic groups in the whole county. How did you get started with that with your partners?
Well, I came to Dutchess County in 2003. I finished my training in New York City in around 2000, went to California briefly for a brief stint there, and then came to Dutchess County because I heard about this practice. So in 2003, we really only had a couple locations, and now since then we've expanded to 5 locations. We have offices in Kingston, we have offices in Rhinebeck, Poughkeepsie, of course this office here in East Fishkill, and we have an office in New Windsor as well. So.
That's wonderful. I know I see the office in Poughkeepsie. Is that your biggest office?
Yeah, that's kind of our headquarters. Yeah, we have a surgery center there, a big physical therapy unit. We have a smaller one here in East Fishkill. MRI, a complete sort of one-stop shopping there. And Orthopedic Express, of course, too, is there.
Right, and you did a wonderful job. This is a beautiful building that you guys built, and we're so happy to have you in our town. Most towns, they want to find a company like yours to come in here, and we're very lucky to have you. What type of orthopedic specialties do you do here?
Well, I personally do knee and shoulder, both sports medicine and joint replacement. But there are other doctors do other specialties here as well. We have spine, we have foot and ankle, we have dedicated joint replacement doctors, hand, of course, and physical therapy is here, and MRI is here. So really,
so you get it all here,
and pain management too, which is a very valuable specialty. So.
That's excellent. That's really great. So, Doctor, also you're going to be right across the street from one of the largest sports dome in the United States, and that's very exciting. And some people could get hurt when they're playing these sports. So, how about if it's like a Saturday, or it's during the early hours in the mornings or at night, and they need help? What could they do?
Well, Nick, we have a Orthopedic Express here, which is essentially like a mini emergency room for orthopedic injuries. So anything.
Wow.
From broken bones to sprained joints to, you're worried about if you broke something or not. That's a very common reason to go to the emergency room. So, with Orthopedic Express, you can skip the emergency room and get, really the definitive care you need right here, right away. So it's a nice addition to the facility and to the community too. So
thanks for talking with me, Doctor. I think I'm now going to go over to physical therapy and see Lori.
Nick, on behalf of Orthopedic Associates, it's been a pleasure.
Thank you. Here we are in the physical therapy department, and we're here with Lori. Lori, how are you today?
Hi, Nick. Good to see you. Thanks for coming.
Nice to see you. So, Lori, how long have you been doing physical therapy?
I have been a PT for 20 years. I love what I do. I believe in what we do. It's fun to see people get better every day and see the results of our work in here.
That's great. That's great. And this is some wonderful facility you have here. What type of patients do you see here?
We see a large variety of patients. Some could be surgical, whether it's a total hip, total knee, maybe rotator cuff repair, or we could just see an average ankle sprain or a shoulder impingement. We see chronic things. We see something that was acute. Maybe someone hurt themselves at work. So what I like about this place is that we do see a large variety of people. Some of our patients patients are in their 90s, others are just 12 or 13.
Oh, wow. Wow, so you accommodate and you know what to do for any
Well,
type.
it's all orthopedic, so muscles, bones, joints, sometimes neural tension. Yes, so could be something of spinal nature, and yeah, we adapt according to that person.
That's great, and it's very rewarding to help somebody, and you see that you've worked with somebody for so long, and then you see them get better.
Right. It certainly is. So, again, we have to modify our treatments based on who we're seeing, but it is fun to see people get better in here. Sometimes the young ones, they get better pretty quickly, and again, sometimes people take longer, but it is nice to see people get better.
So is there one type of injury or surgery, should I say, that people are recovering from that is more prevalent, maybe knee replacements or hip replacements than something else?
Not really. We do see quite a few total joints, but I would say our after-school athletes, we see also a lot of again, work-related injuries. It could be, or just someone who stumbled and fell at home, or hurt their shoulder while working as well. So we do see many different spinal injuries as well, or just chronic. So maybe they just have bad posture. We find that people who sit have just as many injuries as people who do manual labor sometimes. It could be from a poor ergonomic setup at work, or just not exercising the right muscles to help them posturally. So we see all different kinds.
That's great. That's wonderful. So Lori, tell me, if I have a hip replacement and I have my surgery and then I need the physical therapy, what happens? I come here, give me the process.
So a patient would see the doctor. What's nice is that we do work out of the same computer here. It's very easy for me to run upstairs and ask the doctor a question if that person was having physical therapy here, if I needed clarification, or just look right in the patient chart of something that the doctor wrote. And then so they come in for the first day and have an evaluation. We go over range of motion and strength and flexibility and mostly the things that they can't do, mostly the things that they're having trouble with because of their injury, or in this case, a surgery. And we see them 1, 2, or 3 times a week based on their needs. Insurance is a little bit of dictating that based on how many visits that they have a year. And we like to leave time to really progress people. But it's great because then if we have further questions even down the road, then we can go upstairs and ask the doctor. But that being said, patients can go anywhere they want. So we do have a large percentage of our patients that also come in from outside doctors.
Oh, that's great.
Yes, so they don't have to use one of our doctors to come here. Sometimes it's just convenience of location. So we're in a pretty good location here, and patients come here because it's easy for them to get to.
Right, and you guys have locations all over the county, and which is wonderful. So they could utilize the doctors, and they can utilize these offices for their physical therapy. Or if they had surgery in another state and they moved here, they could come here.
We have as well. Yes, we do. Yes, we do. We really we try and have fun here as we push people along. We recognize that patients, for the most part, they don't really want to be spending their time here. They're in pain. They can't do something at home. Maybe they can't pick up their small child. They're not working and they really need the income to get back to work. So we recognize that that there are other factors associated with being here that make this kind of what might be otherwise a negative experience. So we really want people to know that they're pushed, know that their programs are personalized towards them, and we like to have a good time doing it so we can really achieve each person's goals.
So Lori, what part of the physical therapy office is this?
Sure, Nick. This is our hand therapy part of the clinic. We have many hand therapists that work with us at Orthopedic Associates, as well as some assistants. It's really, really hard to become a hand specialist, and the ones that we have on staff are just amazing. They're very specialized of what they do with the hand surgeries, whether it's hand or wrist, and that's their whole part that they do over here.
That's excellent. So that's an occupational therapist?
Yes, an occupational therapist.
And they would specialize in the hand hand or the
hands.
wrist?
Yes.
Wow, that's excellent. You offer this in other locations as
In
well?
all of our locations.
Wow, all of them. That's wonderful. That's wonderful to have. And also they work with all different ages also, youths and adults?
Absolutely, and as well as our elderly patients.
So, Lori, not only do you work with so many wonderful patients, you have a great staff that works with you here also.
We do. We're quite experienced here. Chuck is over here, and we have Christine working on someone over here. A couple people, Stevie is out today, and Christine is not here at the moment. But yes, we all work great together as a team.
That's great. That's wonderful. And so, you guys have a good time, I see, working together. It makes the patients feel a little more at ease, right?
Yes, hopefully, yes.
That's wonderful. And thanks again for having us here. I appreciate it.
Great, thanks.
Thank you. Well, here we are in radiology with Tim, the director of radiology. Tim, thanks for having us here today.
Nice to meet you, Nick.
So, Tim, tell us, what do we do here?
So at Orthopedic Associates in our East Fishkill office, we have full-service radiology services. We have a 1.5 Tesla MRI, as well as 2 X-ray radiographic rooms.
Wow. So is that 1.5 Tesla, is that like a super duper MRI?
Yes, we can scan most patients here. We do offer evening hours, as well as Versed conscious sedation injections for claustrophobic patients.
Oh, wow. Wow. So if I had a problem to go inside that chamber, what do we do? Do you sedate me?
Yep, we have a radiology RN that will do an IV sedation, and it sort of puts the patient into a twilight type state, and the patient feels very comfortable and less claustrophobic.
Wow, that's excellent. That's excellent. So they come down here, and this is where you provide that. And what else do we offer for services for radiology?
We have 2 X-ray rooms upstairs, so patients are seen by the doctor, sent over for X-ray, and then they return right to the doctor, and all the X-rays are available right on our computer system for the doctor to review.
That's amazing. So if I have an appointment and I broke my ankle, I come, I get an X-ray, I see the doctor, and he sees the X-ray right away?
Yes, that is correct.
That's awesome. That's great. So you save a lot of time, and all your records are here in one spot.
And we try to make it a one-stop shop, so it's very convenient for the patient.
Well, that makes good sense. That's why our guys are so successful.
Yes, definitely. Thanks.
Here we are with Tanya, the office manager. Tanya, how are you today?
Very good. How are you?
Great. Thanks for having us here.
Absolutely. Our pleasure.
So how long have you been with Orthopedic Associates?
About 4 years.
Well, that's wonderful. And you guys have a great facility here. It must be wonderful to work here every day.
Absolutely. I enjoy it.
That's great. That's great. And so, Tanya, tell me, is this what area are we in here?
The reception area.
That's wonderful. So when you first come in, this is who you would check in with, one of these nice ladies?
Absolutely. You would check in. They would go over your insurance, verify everything.
And then you would direct them to wherever we have to go, to the doctor or to see X-rays.
Or physical therapy, occupational therapy.
Right. So is there other waiting rooms also?
Yes, they're upstairs.
And so how would they know where to go? What would they tell the patient?
Well, when they check in, they would let us know which doctor they're seeing. If they're not sure, then we look it up, and then we would direct them accordingly.
Okay, that's great. That's great. Maybe you could show us those waiting rooms
Absolutely.
upstairs?
Yes.
Okay. Tanya, here we are upstairs in the patient lounges. So what do you wait for in the red patient lounge?
For the orthopedic doctors, for pain, for your knee, for shoulders, elbows, that sort of ailment.
Okay, and if they have to go to the tan patient lounge?
It's for our pain and spine patients.
Great. And then if they want X-ray, that's another separate lounge.
Correct. It's just right past the tan lounge, and they would sit in the blue chairs.
Okay, great. So this is a very simple way for the patients to know where they're going, and then they get all the care they need.
Absolutely. We're color coordinated, so we're very specific with the instructions, so patients really shouldn't get lost.
That's great. Thank you. So Tanya, the Orthopedic Express, that is a wonderful part that you have in addition to your facility here.
Absolutely.
So tell me, if I break my ankle and I could just walk in?
Yes, you could, and you would get put on the doctor's schedule, and you would be seen.
That's wonderful. That's wonderful. Especially, you know, they're building one of the largest sports dome in the country right across from
We're
here.
very excited for that.
Yeah, that's. I bet you'll have some business from that because there's injuries all the time in sports.
Absolutely. And our doctors are some of the best sports medicine doctors.
That's wonderful. That's excellent. And you offer all types of payment, all different insurances you accept?
Yes, absolutely. No fault, workers' comp, and the majority of commercial insurances.
That's wonderful. That's excellent. Well, thank you so much, Tanya, for all your help today.
Thank you so much. It's been a pleasure.
Thank you. Well, what a treat this was today, Doctor, to see this whole facility. And I got to tell you, my hats and congratulations to you. You have a wonderful facility, and we're thankful that you're here in our town. And we look forward to doing many years of business with you.
Thank you, Nick.
Have a good day.